Hey everybody, welcome to tonight's presentation all about managing your weight by addressing insulin resistance. It can take a couple minutes for everybody to hop on, so I'm just going to wait a couple minutes. If you can, while we wait, please find the chat box in the Zoom room. This chat box will allow you to ask questions as we go. I'll do a Q&A at the end, so if there's anything that has been missed, please let me know. We'll get to them at the end. For those of you who are popping on, if you can find that chat box and let me know where you are from, that would be particularly helpful as well. I always love to see where individuals are tuning in from. Now, I myself want to find the chat box here. Okay, Mexico, Toronto, Miami, Windsor, BC. Hello, everybody. Thank you. Now I see the chat box. So I'll keep an eye on this. Port Elgin, Windsor, Houston, San Antonio, UK. Oh, fantastic. I think it's really late or really early in the UK right now. Las Vegas, London, Florida, Massachusetts. Hello, everybody. Thank you for joining. So tonight we're going to be talking all about one of the things that I'm very passionate about, something that I love to talk about, I love to educate on, and I truly feel that when you can understand what's going into your body and what's happening in your body, you can truly make informed health choices to improve your health. So I hope this presentation is valuable for you. Hope you get some insights and questions answered. We're going to be talking a lot about different supplementation, what insulin resistance is, different medication options. So perhaps if you're on a medication, this can gain some clarity with respect to why you're on that medication and what the indications might be. And what I'm going to do now is I'm just going to turn my video off so you can see a full screen, and then we'll dive right in. So again, ask your questions as we go so I can answer them, as well as if I miss your question, we'll get to it at the end. I am assuming that everybody can hear me. Can you just put in the chat box that you can hear me? If you're having any IT issues, what I would suggest is you just try to re-log on. Seeing a lot of yeses. Okay, fantastic. Okay, so for tonight's presentation, you are in the right place if you are struggling with weight loss resistance, especially that weight gain around the midsection. You've probably tried the conventional eat less and exercise more, and you're not seeing the results that are expected. You're in the right place if you have low energy. Either you have or suspect insulin resistance. Maybe you've been told that your blood sugar is a little bit high, or you're pre-diabetic, or maybe you have type 2 diabetes. We're going to be diving into how you can help resolve that. Perhaps you have high blood pressure, high blood sugar, high cholesterol. We're going to really educate on why all these things happen together and really how to address the root cause. So full disclosure, I am a licensed naturopathic doctor, functional medicine practitioner. I do have a private practice. I am the author of Wild and Free, a best-selling book available on Amazon, as well as the creator of the Metabolic Reset program. Now, if you're having troubles with the audio, what I would suggest is go out and log back on. I think everybody else said that they could hear. If it's repeating, it could just be that your speakers are on or some IT issue like that. I do hold a Doctor of Naturopathy degree and a Biomedical Science honors degree, and this information is for educational purposes only. I cannot provide specific medical advice on this presentation. If you are a patient of mine, we definitely can discuss one-on-one treatment plans at our visit. And one of the things that I'm a really big believer in is true informed consent. In order to make informed consent with respect to the best health decisions for you, you need to be provided with all of the information, which goes into the benefits, the risks for each treatment option that's presented to you, as well as the alternatives. So in my practice, one of the things that I like to go through is what all the different lab markers mean, what are optimal versus normal levels, and then we discuss here are the medications that you could use, benefits and risks of each, here are the supplement options, here's the dietary interventions, and then each patient gets to make the informed choice with respect to what treatment plan they want to get started with. In terms of some statistics, there was a recent study showing that only 12.2% of American adults are actually metabolically healthy. So this means that a significant portion of the population is struggling with metabolic disorders. Metabolic disorders could be anything like obesity, high blood pressure, high cholesterol, and type 2 diabetes. And what we have to recognize is the normal ranges on labs are very broad. In conventional medicine, we are looking at whether or not you have diabetes. So do you have diabetes? yes, you get treatment. And if not, you're kind of left watching and waiting. And I think this is a really big missed opportunity to intervene at this point in time to really help change the health trajectory of patients. We know that even a 5 to 10% reduction in body weight reduces the incidence of type 2 diabetes, or reduces the probability of type 2 diabetes by over 58%, which is amazing. But we also know that telling patients simply to eat less, exercise more, has only a 0.4% success rate. So we have to do more education, we have to do more comprehensive testing to really get to the root cause of what's going on to help patients succeed. What are some of the signs and symptoms that patients might experience who have insulin resistance and metabolic disorders? We can see the resistant weight loss that does not respond to diet and lifestyle. And unfortunately, many individuals are just told, well, you just eat less, like just keep going, cut your calories more, exercise more. I have many patients on a very low calorie diet, very, very low, and they're doing a lot of exercise. They're putting their best effort forward and not seeing the results. And there are other things that we can do to address the hormone related concerns to see success. Weight gain around the midsection is a big sign of insulin resistance. Mental health concerns, even anxiety, depression, irritability, can be resulting from ups and downs in your blood pressure, blood sugar. Blood sugar as well for women can cause hot flashes in perimenopause and postmenopause. It can cause sleep disturbance, so you're waking up typically between 2 to 4 a.m. You're maybe having a hard time falling asleep, feeling tired but wired, but then you wake up in the morning feeling unrefreshed and the cycle starts over. Daytime fatigue, fatigue after meals is a really big sign as well. Skin concerns like acne, oily skin, hair growth on the face in women, which we call hirsutism, hair loss on the head, skin tags, HS, darkening of the skin that we see around the neck, perhaps the armpits and behind the knees, irregular menstrual cycles and infertility in women, as well as low testosterone in men. We can also see elevations in blood pressure, a higher amount of fasting glucose, and we're going to review these labs in slower picture detail so that you can understand what each one means. A higher triglycerides, higher cholesterol, especially high LDL, which is the quote unquote bad cholesterol that we don't want. But we also see reductions in the good protective cholesterol called HDL. Another telltale sign is you can measure your waist. So if you have a waist over 40 inches in men and over 35 inches in women, that is correlated with insulin resistance as well. So a simple tape measure, you can do your waist measurement at home. What you will learn. So we are going to discuss how to properly test and diagnose insulin resistance. We're going to talk about why weight loss is particularly challenging with insulin resistance and how fixing the insulin resistance can make weight loss a lot easier. We are going to know how to manage your weight in a proper way in terms of addressing the root cause. We're going to talk about nutritional strategies that you could consider implementing. We're going to talk about some key supplementation strategies and medication options. So what is insulin resistance? If you're a patient of mine or if you've watched some of my videos on Instagram or TikTok, you know that I love these pictures because I really feel that it helps explain exactly what's going on. So when you eat carbohydrates, whether they're healthy carbohydrates like fruit and vegetables or unhealthy ones like cake and cookies, carbohydrates are broken down through digestion and glucose will enter the bloodstream. This is healthy and normal. This is what should happen. Then what happens is once you have a rise in glucose, which is these red squares, that will signal to the pancreas, another organ, to produce insulin. And insulin here is depicted as the keys. The role of insulin is to open the door on the outside of a cell to get the sugar into the cell. It is very, very important that we get the sugar from your bloodstream into the cells because this is how we generate ATP or energy. So it's important for your muscles to work. It's important for mental clarity. It's important for your energy. It's important for weight management that you can get your sugars from your bloodstream into your cells to burn it for energy. What we see in insulin resistance is there is an issue with the lock and key on the outside of the cell. So we see that the lock becomes damaged and the key won't fit. If we go back to this photo, if the key cannot open the door and the sugar stays in the bloodstream, that's going to tell the pancreas, sugar is still available, make more insulin. And the problem with having, if you have 100 keys or 200 keys of the exact same copy, if the issue is the lock, that is not going to be helpful. There was a question here, is there no picture for anybody else? Can you guys see my slides? Just want to make sure that you can see this. Yes. If you're having a problem with the slides, I would suggest closing it out. I'll go slowly so you can catch up and then come back in. Some individuals say they can't see the slides, some say that they can. All right, give me a second here. I'm going to stop the share, and then we're going to share this again. All right, what about now? Is that better? If you're on your phone, that could be the problem. Try swiping left or swiping right to see if these slides come up. Now it worked. Okay, so if you're on the phone, I would suggest that there's probably another button, maybe 3 little dots, or swipe left or swipe right, to try to be able to see it. Okay, most can see it, good. All right, so we talked about if there is 100 or 200 copies of the key, but the lock is the issue, it's not going to work. So what happens is we see a rise in your blood sugar and a rise in insulin. Your body is always going to try to protect you. There is damaging impacts to having high blood sugar. Can damage your nerves, can damage your eyes, can damage your kidneys. So as a protective mechanism, under the influence of high levels of insulin or a lot of keys, what'll happen is your body will take the glucose from your bloodstream and put it into storage as body fat or stored away around the liver. You can see fatty liver, stored as triglycerides. Now, the problem with this is, one, it makes it much more challenging to lose weight, but also your cells have not received glucose. Your cells have not received energy. So you are cellularly starving. That's where we can see the sugar cravings. That's where we can see the low energy. So what we really need to do through diet, lifestyle, key supplementation, and/or medication is fix that lock and key so the sugar can enter into the cells so that you can feel good and your weight is easier to manage. Carbohydrates are not bad. With the push of a low carbohydrate ketogenic diet, individuals get really stressed out with carbohydrates. The carbohydrates are not the problem. It's the hormone response to carbohydrates that's the problem. If we can fix the hormone response, you will have much more metabolic flexibility where you can consume both carbohydrates and fats and not see the problems with your weight increasing. Many individuals with insulin resistance will feel particularly tired after the meal, right? Because the blood sugar is all going away to storage. And they can say, I've heard, I look at carbohydrates and I tend to gain weight. So that's a telltale sign of insulin resistance as well. Here's another picture to help explain it. This is a normal insulin, normal metabolism. So this is the lock and key here. You've got glucose in the bloodstream. Insulin binds to the outside of the cell, opens it up, and then you get sugar inside your cells. On the right-hand side here, we see an elevation in glucose in the bloodstream and low amount of glucose inside the cells because it cannot get there. And that results in more glucose, more insulin in the bloodstream. Here's what happens when you have insulin resistance. You should have stable blood sugar throughout the day, right? You eat a meal, your blood sugar goes up, but it gets into the cells and goes down, nice within this tight range. Individuals with insulin resistance will see these blood sugar spikes and low blood sugar. So it's up and down, up and down. And this can cause feeling hangry, irritable, mental health concerns, low energy, brain fog. So if we can get individuals back into the stable blood sugar range, they are going to feel much better. This slide is going to be how insulin impacts hormones in women. The next slide will be how insulin impacts individuals who are male. Insulin resistance, meaning higher levels of insulin or hyperinsulinemia here on the left, causes changes to cholesterol and metabolism. So we see elevations in the bad cholesterol LDL, elevations in triglycerides, lower amounts of the good cholesterol HDL. In women, there is a reduction in something called sex hormone binding globulin, which you can think of as the catcher's mitt that binds onto your hormones. So we see increased free testosterone. Now, why is this important for women? In women who are experiencing acne, irregular cycles, hair growth on the face, hair loss on the head, it could be a result of the free testosterone. Instead of jumping to a medication that simply lowers testosterone, we need to check if there's higher levels of insulin and treat the underlying issue. Treating the underlying issue can help here. In women, higher amounts of insulin changes the brain signaling to the ovaries. We see changes in hormones like LH and FSH. The details are not important here, but essentially what happens is we see lack of ovulation. If you don't ovulate, you're not going to have regular cycles. If you don't ovulate, you can have significant PMS. In terms of males, we see something similar. So insulin resistance, increased adipose tissue or fat tissue here will cause an increase in pro-inflammatory cytokines or an increase in inflammation. Now, the problem with this is for men, what'll happen is we see an increased estradiol levels. In men, we really want to keep healthy estrogen levels. You don't want it too high, you don't want it too low. Both high and low estradiol can contribute to an increased risk of cardiovascular disease. The other problem with having insulin resistance and high estrogen in males is it can lower testosterone levels. And we definitely see an association between low testosterone and insulin resistance in men. There is a bidirectional relationship, meaning low testosterone can make insulin resistance worse, and insulin resistance can lower your testosterone. It's a vicious cycle. So addressing both can be particularly helpful in males. Now, what are the labs for insulin resistance? Before we go on to this, does everybody understand more or less what insulin resistance is? Were those photos helpful? Is there any clarification that is needed? And then we'll dive into the labs. Good, okay, perfect. And this will be recorded. I'm going to send out a recording about 24 hours after the presentation, so if you need to review these slides, you definitely can. So what are the labs that we would run for insulin resistance? We want to know what your fasting sugars are. So what is the exact blood sugar at the time we do the blood draw in the morning? It's also really important, and I hope you can appreciate that from the last slides, that it's important to measure what the fasting insulin is as well. Hemoglobin A1C tells us, on average, in 3 months' time, how are you managing your blood sugar? But remember from that previous slide when you can have high highs and low lows, the problem with just looking at a hemoglobin A1C or just looking at the average, of course, an average can be normal if you're having high highs and low lows. You're going to have symptoms, but unfortunately, you'll be told, oh, everything's great, nothing to worry about. We also want to know, with respect to the fasting insulin, how hard has your body had to work to keep your blood sugar under control? Or how many copies of that key did your body have to produce to keep your blood sugar under control? If you are producing 2-3 times the optimal range of insulin or producing tons and tons of those keys just to get the sugar into the cells, you saw on the previous page, your blood sugar can be normal, but if you have that high fasting insulin, you can see cholesterol issues, you can see weight gain, you can see changes to your hormones. So measuring all of these is important. A lipid panel is important too. So if your cholesterol's high, but your insulin's normal, then that's going to be a different treatment plan. If your cholesterol's high and you have a high fasting insulin, we need to fix the insulin resistance problem. A statin medication is not going to fix the insulin problem. It can lower your cholesterol, but one of the things that statins can do is cause a lot of muscle pain. In addition, it lowers CoQ10, which is an important nutrient for the heart, and statin medications have been shown to make insulin resistance worse. So that's not ideal. Some individuals have to be on a statin medication to prevent a heart attack, absolutely. But at the same time, we need to look at the insulin and treat that so the cholesterol can get better. There are 2 optional tests that you can also have a look at for blood sugar management. There is something called a 2-hour oral glucose insulin test, which we'll talk more about in the upcoming slides. This is essentially you go into the lab, you haven't had anything to eat, and you drink a not so delicious drink of 75 grams of sugar. And once you drink that drink, we measure your blood work at 30 minutes, 1 hour, and 2 hours to get a real-time picture of how your body responds to that load of sugar. We want to know what the sugar is, but you also have to know the insulin. So sometimes doctors are only measuring the 2-hour glucose test, which is fine to understand where your sugars are, but I want to know how hard has your body had to work. Here's a classic example of some patient cases that we'll go through. So this is a patient of mine that we ran some blood work on. We are often measuring a lot more labs than is just going to be shown here. I measure a lot in my practice, everything from hormones to thyroid to inflammation to cholesterol. In this presentation, we're going to be focusing more on the blood sugar piece. So this individual had a fasting blood sugar of 6.0, so just at that upper range. There was a hemoglobin A1C, or the 3-month average of the blood sugar at 5.6. This is typically all that's run in conventional medicine. The problem with this is I see it time and time again. This patient will either be told that there's nothing wrong with their labs, everything's normal, because technically they're just falling in the at-risk category. So they're either told they're normal, they assume they're normal because they didn't get a phone call, or their doctor simply tells them to eat less and exercise more, which we know from clinical research is not effective. This is a missed opportunity to reduce the risk of developing prediabetes and diabetes in the future. In my practice, I always run a fasting insulin and look at here. So if you look at just these first two markers, you're like 0.1% over the at-risk category, not a big deal, but look at the fasting insulin. The fasting insulin is at 221, well above the normal range. And we have to remember, these ranges are huge. These ranges just mean, can we fit 90+% of the population into it? Do they have diabetes? Do they not? This individual is really going to struggle with energy, mental health concerns, resistant weight loss, weight gain around the midsection. I like to see an insulin around 20 to 60. Now, the reference ranges for Canada are different than the US. In the US, this would be approximately a 2 to a 6, although it is patient dependent. So if an individual has an easy time managing their weight and they feel really good and they have an insulin of 7 or an insulin of 60 for the Canadian units, not a problem. This is where we have to pair the labs with your symptoms. So this patient definitely needs to have treatment. In addition, what we are seeing here is after a 12-hour fast that this patient's triglyceride levels are starting to go up. Ideally, I want to see a triglyceride at 0.8. So the fact that it's increasing and there's insulin resistance present is even more of a reason to treat it. Cholesterol, the cholesterol should be around 5.2. The HDL cholesterol, this is too low. We want to see it around 1.3. So again, just reiterating all of the changes that we see for individuals with insulin resistance. Now, if you don't measure the insulin and you just have a look at a lipid panel, all the time lipid panels are being run, and this patient probably would have been told, you need to change your diet, we'll repeat this in a year, but if it doesn't change, you need a statin medication. That is a really big missed opportunity to implement some key strategies to help this. There's a really great comment that you can calculate the HOMO-IR online. So HOMO-IR is another marker for a predictive factor for insulin resistance. If you have a test where you can see your blood sugar and your fasting insulin, you can use the online calculator to calculate yes. Okay. We also measured the thyroid function. The thyroid function was completely fine. I have other presentations on thyroid-related concerns if you want to check those out to see what the optimal versus normal ranges are. I also run a sex hormone binding globulin. Again, it's that catcher's mitt that binds onto hormones that makes them inactive. So this patient had a relatively low sex hormone binding globulin. It's at the lower end of the range. We see this in individuals with insulin resistance, as we previously saw. High cortisol can help lower this as well, and hypothyroidism. So we know the thyroid is optimal, but we have to look at where's the cortisol and where's the insulin resistance, because having a low sex hormone binding globulin can cause acne, increased appetite, weight gain, mood swings, fluid retention. So all things that we can help to correct here. CRP, this one at the very bottom, this is a marker of inflammation. We do not want an hsCRP to be high. This increases your risk of cardiovascular disease and stroke. Unfortunately, many of the labs have increased the threshold for CRP. Some labs even have it up to 5 as being normal. It no longer gets flagged. And the problem with that is individuals are now at increased risk of cardiovascular disease, but we've just changed the standard and said, oh, well, that's normal because majority of the population has it. And I think that's not optimal and a missed opportunity to do something. hsCRP, anything above 2, ideally, you don't really want it above 1, is something that we want to have a look at correcting. Do you have issues with joint pain? Could there be an autoimmune process like rheumatoid arthritis present? Do you have food sensitivities? Do you have gut imbalances? Are you having insulin resistance? How's your cortisol? How's your sleep? All things to consider when the inflammation's high. We also run a vitamin D. And the reason I run a vitamin D for individuals with resistant weight loss is because we know there's an association between low vitamin D and insulin resistance. In men, we also know that low vitamin D can contribute to low testosterone. And what we saw before is low testosterone makes insulin resistance worse, and insulin resistance contributes to low testosterone. So everything is connected, which is why we need to do the comprehensive testing. Vitamin D is a really important nutrient, not only for your immune system, your mental health, your thyroid gland, your hormones. It is a really important one that we should be measuring. Here is a depiction of that 2-hour oral glucose insulin challenge test that we talked about, the one where you drink that delicious drink of 75 grams of sugar. So at the 0 baseline mark, that is where we would measure what is your baseline sugar, what is your baseline insulin. Then you drink the drink, and what we should see is the dotted line. Dotted line is normal. We should see the glucose go up, and we should see the insulin go up. Once the insulin goes up, we should see the glucose go down as a response. For individuals with insulin resistance, we can see the glucose go up and the insulin go up. For some individuals, the insulin is still rising at that 2-hour mark. Here's another example. Hemoglobin A1C, so the average 3-month measurement of your blood sugar. This individual was completely normal, 5.3. They got a check mark saying, nope, you're healthy, no prediabetes, no insulin resistance, you're great. But if you don't measure the fasting insulin, you're going to miss things. So the fasting insulin was 203, well above optimal. So yes, the blood sugar is under control. We're happy this patient doesn't have diabetes, but the body is having to work extra hard with the insulin. In addition, we did the oral glucose insulin challenge test because we were curious to see what was going on. You can see here, look at the 2-hour mark, 1,338. That is really high. At the 2-hour mark, that insulin should be coming back down to baseline. The half-an-hour one was elevated, the 1-hour one was elevated, and the fasting insulin was elevated. And the blood sugar was particularly high. So this individual, yes, their 3-month average was fine, but they're having significant high highs and significant lows, which makes the average normal. Other labs for insulin resistance. There are other conditions that mimic or can be very similar with the signs and symptoms for insulin resistance. So we want to have a look at a full thyroid panel to rule that out. A full thyroid panel means TSH, free T3, free T4, reverse T3, and the antibodies. We want to have a look at the cortisol levels. Cortisol issues, stress issues, and insulin resistance often go hand in hand. We want to have a look at a prolactin. For women with PCOS who are having irregular cycles, it could be due to insulin resistance, could also be due to higher prolactin levels. Leptin is another important hormone for satiety. So if an individual is really hungry all the time and is having food cravings, insulin resistance, yes, can make that worse, but so can leptin resistance. So measuring those levels and knowing if you need to address both is key. For individuals with leptin resistance, sometimes this is genetic, but just because it's genetic does not mean there's nothing that we can do about it. So for individuals who have been successful with weight loss but still have leptin resistance, it's a high probability that that weight will come back. So what we need to do is we need to address the leptin resistance. We need to keep the hunger and satiety cues under control so that weight loss can be sustained. Leptin resistance can persist up to a year post-weight loss. So that's where we're looking at making sure to have an abundance of protein, adding in amino acids, adding in additional fiber, having an abundance of fruits and vegetables. The treatment will look different for each individual. The vitamin D and other nutrient deficiencies, we want to measure the hormones too to see, where are your hormones, where's your estradiol, your progesterone, your testosterone, and do they get better once the insulin resistance is addressed. If you are interested in running labs, I know it can be particularly challenging to get all these labs done. There is an option called Rupa Health. I've partnered with Rupa Health to offer the comprehensive panels. You can order them online. Right now, this is USA only. If you are in Canada, if you're in Ontario, we can run the labs for you, not a problem. The other provinces are a little bit more challenging, but you can reach out to my office to see if we have partnered with a practitioner in your province. The labs that we're offering through Rupa Health are the comprehensive panels. So this would be a female panel that I would classically run in my practice, a male panel that I would run in my practice routinely, as well as there is a separate panel for women who are on hormone-based birth control. If you are on hormone-based birth control, there are a couple markers that we don't need to run because they will simply show that you are on birth control. So this link will be emailed out to you in the review email 24 hours after if you want to check it out. How this works is essentially you order online. You click add to your cart, you put your credit card in to pay. Rupa Health will ship you a lab kit. It ships the next day. It's really quick. You'll get the lab kit in the mail. You simply enter in your zip code to find labs in your area. There are phlebotomists that will come to your home as well in particular areas. And you have the blood draw done and the labs will be released to you once they're available. So if you're having a hard time getting testing, if your doctor's not going to run it for you, this is an option. In terms of will my insurance cover this, it really just depends on your health insurance account. So you want to speak with them. How does insulin resistance develop? There are genetic predispositions, but with diet, lifestyle, and supplementation, we absolutely can mitigate the impacts of genetics. There's stress. We're going to talk about why that is. Nutrient deficiencies can make insulin resistance worse. Gut bacteria imbalances, which we'll dive into in a little bit. And then, of course, overconsumption of carbohydrates or poor dietary habits. Yes, nutrition can lead to insulin resistance, but it is less commonly the only contributing factor. What are the impacts of stress? We have to keep an eye on stress levels, not only mental, emotional stress, but we have to recognize those big ups and downs in your blood sugar can contribute to stress as well. Chronic inflammation is a stress on the body. Poor nutrition is a stress on the body. Infections are a stress on the body. So it's not just about mental, emotional stress, but there are other things that could be going on within your body that are elevating your cortisol levels. Ways to reduce stress. I know this is very basic, but always a good reminder to go back to the basics. Exercise can be incredibly powerful for your mental health, but it's important not to overdo it. Yoga, gratitude, meditation. There's a 5-minute journal that I absolutely love. Do that quick in the morning or before bed. Connect with loved ones, counseling, therapy. Self-care is really, really important. Set healthy boundaries. Evaluate, is there anything in your life that you can take off your plate? What do you truly want? I cannot emphasize the importance of stress enough. Lack of sleep is a huge stressor. And many individuals are staying up really late on social media, scrolling through their phones. That blue light can really negatively impact your sleep. If you don't sleep enough, you are going to have issues with your blood sugar. You're going to have issues with hunger and satiety. Your cortisol is going to be increased. Your glucose is going to be increased. Your ability to manage your insulin and that insulin sensitivity, so the ability of the key to fit in the lock, is going to be impacted. We know that there is elevations in inflammatory proteins, IL-6, TNF-alpha. These are just markers of inflammation, CRP. They are going to be increased if you do not get enough sleep. In terms of stress, in terms of your ability to sleep, if you're looking for some additional support, a couple of my favorite ingredients would be things like Sensoril. This is a standardized form of ashwagandha. L-theanine is really great at calming the nervous system. Relora is really great at increasing DHEA, your anti-aging hormone. This can particularly help your body cope with the physiological impacts of stress. Can also help to promote healthy cortisol levels, help sleep, help with mental clarity. Now, who would this not be for? If anybody has PCOS or higher levels of testosterone, this can raise your testosterone further. So ashwagandha has been shown to raise testosterone. So if you have high, might not be the best one. But for women with low testosterone or males with low testosterone, reductions in sex drive, this can be particularly helpful. Nutrient deficiencies. So we do know that altered levels of particular nutrients can make insulin resistance worse. I really love this chart, and I can link the research. It's all there at the end of the presentation. But these are all the key nutrients that are needed to create a stable blood sugar panel, help with insulin resistance. Iron is a big one. If your iron's high or low, we can see impaired glucose metabolism. I cannot tell you the number of women in my practice with low iron. Magnesium is another important one. Magnesium is the most common mineral deficiency. It's deficient in our soils, and we're not getting enough fruits and vegetables. So do you have to take every single one of these supplements? Absolutely not. But we need to figure out what we can do from a nutrition standpoint to ensure that you're getting adequate intake. We also need to look at your digestive system to ensure that you're absorbing all these nutrients from food. The one that was not included in the study was vitamin D, but of course we know that is particularly important. Selenium and zinc, you can get those from selenium. A great source is Brazil nuts. Zinc, a great source is pumpkin seeds or oysters. These are all nutrients that you really can get in when you start to prioritize an abundance of fruits and vegetables and lean proteins. Why is iron a big deal? Iron is a big deal because iron is needed to build thyroid hormones. It's also important for converting tyrosine to dopamine, your motivation hormone. The iron reference ranges are really big. You need to have an optimal iron level to have good oxygen carrying capacity so that your brain can think, so that your muscles can work. And as we tie this into glucose and we tie this into insulin resistance, iron deficiency has been shown to impair glucose metabolism. So for anybody who's been told, oh, you're anemic, or oh, your iron's low, just take a bit of iron, that's not good enough. You need to know how much iron you need to take. Why are you not absorbing it from your diet? Or maybe you're not getting enough in your diet. Are your menstrual cycles, if you have a period, really heavy? How can we fix that? And how long should you be on that supplement for? So repeat labs need to be done to ensure it comes up into the optimal range. Gut health is a really fascinating topic for me. I love reviewing the literature on this. So this was one of my favorite studies that was done in rats. It has been repeated in humans now, but essentially they had two genetically identical rats. One was obese, one was lean. So these were twins. And the researchers set out to understand what were the key differences in the gut bacteria that could have related to this change in weight. And they found that there was key differences between the two. Then what they did is they did a stool transplant. So they took the feces from the obese rat, transferred it into the lean rat. That lean rat did not change its diet or exercise, but it became obese just by the fecal transplant, which is pretty profound. And again, this has been repeated in humans. And the key things that we are seeing is that the gut bacteria can influence the amount of calories that are being absorbed from the foods you eat, and they can impact inflammation, your blood sugar, and insulin levels. So what can we do about it? There are key strategies that you can utilize. Metformin is a pharmaceutical that does appear to have positive benefits in the gut microbiome. We'll talk more about the benefits and risks of this medication at the end. Berberine is a natural alternative that has been shown to have some positive benefits on the gut microbiome, influencing it in a way to promote weight loss, as well as reducing any bacterial overgrowth. The other thing that they found in this research is that individuals with obesity had a lower diversity of gut bacteria. Now, what are we doing in our lifestyle to reduce the diversity? Number one, we're not consuming an abundance and enough diversity of fruits and vegetables. So the more vegetables you consume and the more different types of vegetables or different types of fiber, the better diversity of your gut microbiome is going to be. Get outside, be in nature, avoid antibiotics when they're not necessary, avoid pharmaceutical medications when they're not necessary, and ensure that you're getting adequate sleep, managing your stress levels. Don't overconsume sugars. Careful with the artificial sweeteners. There is some small studies that show that perhaps aspartame can lower the beneficial bacteria. Reduce sugars, reduce processed food, and alcohol is another one that can cause issues with respect to the gut microbiome. Another key bacteria that helps with weight loss is called Akkermansia muciniphila. When Akkermansia is low, we see an association with more obesity, more inflammation, and more resistant weight loss, more insulin resistance. So what can you do to promote increased levels of Akkermansia? More diversity of fruits and vegetables, lean protein, watch with the amount of processed deep fried oils, seed oils, get those out, canola oil, vegetable oils, reduce those. In addition, things like curcumin, berberine, fibrine, and a very particular type of probiotic called Bifidobacterium B420 has been shown to increase Akkermansia. The particular strain is right here. Bifidobacterium animalis subspecies lactis B420. Glucomannan fiber has positive impacts. Polyphenols or anti-inflammatories, things like resveratrols, berries, address inflammation, avoid a processed food, high-fat diet, and avoid excessive alcohol consumption. And all of the links to this research are going to be at the end as well if you'd like to review it. If you want to measure your gut microbiome to see what your levels of Akkermansia are, you want to see what your normal bacteria is, you want to see how you're digesting your foods, do you have any bacterial overgrowth, parasites, candida, worms, there is a test available on the same link called the GI Map stool test. I have another presentation going full depth into the GI map, but this is one of my favorite DNA-based PCR tests for having a look at the gut microbiome and whether or not this is playing a role in resistant weight loss. Tummy Tone and the Fiberline. I created these two products to support Akkermansia levels. Bifidobacterium B420 has been shown to reduce fat mass by 4% after taking for 5 months. When combined with propylamanin fiber, we showed significant benefits compared to the placebo who didn't take anything in the reduction of body fat mass. And these results were independent of diet or lifestyle. So there was no changes, no recommendations for calories, no recommendations for exercise, and most of the reductions in fat mass were seen around the abdominal region and the waist circumference. Nutrition. Nutrition is key, nutrition is foundational. There's a lot of confusing information out there with respect to what nutrition plan would be best. Paleo, low carb, keto, gluten-friendly, dairy-free, Mediterranean diet, it all becomes very overwhelming, and I like to keep it very simple. The American Society of Reproductive Medicine shows that healthy behaviors, including healthy living and regular physical activity, are recommended to achieve or maintain a healthy body weight. So nutrition does matter, of course, but the problem is simply telling somebody in a 2-minute office visit, eat less, move more, has a very, very high failure rate. So we really have to get specific with this. What does it actually mean? And what can we do in addition to nutrition and lifestyle to help patients see better improvements in their metabolic health? One of the things that I like to see is patients reducing the amount of seed oils, eliminating the vegetable oils, the canola oils, of course, but also have a look at how you're cooking your food. So a 2011 study showed that individuals who have a high AGE diet, what does that mean? So AGEs, or advanced glycolic end products, are harmful compounds that come from cooking oils at high temperature, and they can cause inflammation and increased risk of insulin resistance and type 2 diabetes. So I want you to look at when you're heating oils, and is there an opportunity to reduce that? What the 2011 study showed is that restricting AGE foods may help preserve the body's natural defenses against insulin resistance by preventing the development of oxidative stress. So when you're cooking, if you're using olive oil, and there's an opportunity for you to use something like a broth, like a vegetable broth or a chicken broth, try that out and see if it helps. In addition, there was a January issue of the Current Diabetes Report that showed that lowering dietary intake of AGEs could improve hyperinsulinemia, or high insulin in the bloodstream, by about 40% in type 2 diabetes patients, which is pretty big. So AGEs are going to be really high in foods that are deep fried. So the more you can limit that or completely take it out, the better. And if you're cooking at home and it's easy for you to reduce the amount of oils that you're cooking with, add the oils after so that you're not heating them at high temperatures. Avoid the processed and packaged foods, eat more fruits and vegetables, cook with the broths or waters. I always have a container of chicken broth and vegetable broth in my cupboard, and that prevents it from sticking. If there's meals where you're like, that's not going to work, that's okay. But if there is some opportunities in certain aspects of your cooking to help reduce that, great. In addition, another way to reduce AGEs, you can get high AGEs from cooking meats on the barbecue, especially if they're marinated in oils. To mitigate some of that, use a marinade that also has something acidic in it, like wine, vinegar, or lemon juice. Eat real foods, of course. Avoid the processed foods. Eat foods that come from the farm, not a factory. Avoid or minimalize grains and dairy. Eat more fruits and vegetables. Aim for at least half your plate to be vegetables. If you have a food scale at home, or this would be something that would be okay with your mental health to do, measure out your protein. See if you are getting at least 5 to 6 ounces, or at least the size of your palm with each meal. I find that many individuals are under consuming protein. Eat organic, pasture-raised beef and chicken, grass-fed beef, grass-finished beef, wild-caught fish, especially wild-caught salmon, if you can, because that has better nutrient content. I also want you to focus on cruciferous vegetables. There was one study that showed you are 22% less likely to die from all causes by consuming cruciferous vegetables every day versus consuming cruciferous vegetables once a week, which is really profound. If you take one thing away from this presentation, is that you need to consume cruciferous vegetables every day. Broccoli, kale, cauliflower, bok choy, Brussels sprouts, cabbage, these are cruciferous vegetables, and they're high in an active component called sulforaphane. If you don't like these vegetables, consider trying broccoli sprouts. You can add that to a sandwich, you can add that to a wrap, you can add that to salads. Broccoli sprouts, you can easily grow those at home in a couple days, or you can buy them at the grocery store. Broccoli sprouts are very high in sulforaphane. This was a 2017 study. It was done in mice, so keep that in mind. But mice fed with a sulforaphane-rich diet, which comes from those cruciferous vegetables, exhibited weight gain rates at 15% lower than the mice fed without sulforaphane. And we saw a reduction in visceral fat, meaning the fat around your organs or the dangerous fat in your midsection. So very simple way, eat more cruciferous vegetables. So in a summary, you want to make sure that you have about 30 grams of protein or 5 to 6 ounces of lean protein at every single meal. A food scale is like 10 bucks on Amazon or at, a hardware store or Dollarama. Grab a food scale and just make sure you're getting enough. I find most individuals are just not consuming enough protein. Consume healthy fats, high fiber. If you want to download the free app called MyFitnessPal, I don't want you to track calories, I just want you to track fiber. Make sure that you're getting at least 25 to 30 grams of fiber. Choose carbohydrates from low glycemic foods. Remember, carbohydrates are not the problem, but for individuals with insulin resistance, you're producing the wrong hormone response in response to carbohydrates. So if we can lower that temporarily until the insulin's optimal, that would be fantastic. Increase vegetables, eliminate processed foods, and eliminate sugar. Sugar alternatives that I would consider would be stevia or monk fruit. This is the Freestyle Libre and the NutriSense scanner. So if you are looking for a way at home to monitor your blood sugar in response to the meals you eat in real time, this may be an option. So this little sensor sits on the back of your arm and you can scan it with your phone. These continuous blood glucose monitors can be at a higher price because they are convenient and they are easy. If this is not an option for you, you can get a simple blood glucose monitor kit. Yes, you have to prick your finger each time, but perhaps after doing 2 weeks to a month, you can gain some significant insights into what foods work for your blood sugar and which ones don't. So a continuous or a blood glucose kit, not the continuous one that sticks on your arm, but the one you have to prick your finger, runs about $20 at Walgreens, CVS, or Amazon. I'm also going to send over this chart with the optimal ranges so that you can review it. So maybe you track for 2 weeks' time by just pricking your finger an hour after a meal. Write down what you consumed and write down what happened with your blood sugar. This doesn't tell you about insulin, it just tells you about your blood sugar, but this is often a good learning tool. The Freestyle Libre you can get over the counter in Canada. The Freestyle Libre you cannot get over the counter without a prescription in the US. The NutriSense one would be available in the US, or simply just grab the $20 finger prick kit and do it for 2 weeks to a month. For whatever reason, some individuals respond with really high blood glucose with certain meals. If I eat a steak and sweet potato, I have no idea why, but my glucose will go really high and I won't feel well after. So that was good insight to know, where I just choose a different meat option. I'll choose chicken and sweet potatoes, or I'll do steak and broccoli. Meal timing matters, and we're going to talk here about intermittent fasting. Every time you eat a meal, you're going to raise your glucose, unless it's just pure fats, but most often every time you eat, you're going to raise your sugar and raise your insulin. If you're having breakfast, lunch, dinner, snack, you're going to always be raising your sugars and your insulin. It is better to consume larger meals less often if you have insulin resistance. Intermittent fasting, or consuming all of your nutrients within a certain window, can be particularly helpful for patients with insulin resistance. This doesn't mean that you have to go down to 1 meal a day. Some patients do find that helpful temporarily to get the insulin under control, whereas others like to have the 3 meals just within the 8-hour window. We do know that intermittent fasting increases insulin sensitivity, so helps to repair that lock and key. We see reductions in inflammation, we see improved insulin sensitivity in the liver, and improved energy levels. This study looked at comparing individuals who ate 3 meals a day versus individuals that skipped breakfast. Now, you don't have to skip breakfast. You can skip whatever meal you want, or just push your window whichever way you want, as long as it's in relatively an 8-hour standpoint. If intermittent fasting does not work for you, you also don't have to do this strategy. Now, the reason that we often see benefits to skipping breakfast is that the breakfast is often filled with muffins, bagels, toast, those higher carbohydrate foods. But when we look at studies that have controlled for the amount of carbohydrates and controlled for the amount of calories, we do see benefits just to shortening that window. When you skip breakfast and consume your meals within an 8-hour window, we see increased lipolysis, which means fat breakdown, increased energy expenditure, so you're able to produce more energy or ATP. We see a reduction in fasting insulin, all really positive things for individuals with insulin resistance. Are there any negative side effects to fasting? Yes. If you don't have good blood sugar control, you can go to hypoglycemia or low blood sugar symptoms. If you feel like you're shaky, dizzy, hangry, then definitely you want to respect your hunger cues and have something to eat. If you are type 1 diabetic, you do not want to do intermittent fasting, you want to speak to your doctor. In addition, if you are doing a ton of exercise or you have a low body fat percentage, you don't want to be doing a ton of intermittent fasting, a ton of fasting in general, because here's why. Individuals who are overweight or obese who are doing intermittent fasting or prolonged fast, we actually see the body prefers fat opposed to muscle for breakdown. So during a prolonged fast, fat oxidation accounted for about 94% of energy expenditure in obese patients, whereas it only contributed to 78% in lean individuals. So the risk of breaking down your muscle mass is much more in individuals who do not have body weight to lose. What breaks your fast? Anything that contains carbohydrates is going to break your fast. Anything that contains protein, as long as it's under 25 to 30 grams or 25 to 30 calories, it might be okay. As a basic rule of thumb, I just tell patients don't eat anything, right? Just have black coffee, water, green tea, don't add anything to it. That's not going to break your fast. Stevia won't break your fast either, but I would always start with trying black coffee first. Exercise. We know that exercise is not necessarily effective for weight loss, but it is key for weight management. I always have patients reduce exercise or stop exercise, solely focus on nutrition first, getting their hormones in check, addressing the insulin resistance, addressing the cortisol first. After we've seen some positive movements in terms of the consistency of the nutrition, adding in short resistance training can be particularly helpful for insulin resistance. Weight training is fantastic. The problem I see individuals running into is they are doing 45 minutes, an hour plus of high intensity interval training, lots and lots of resistance training. They're not sleeping at the same time. They're really stressed and they're having a hard time recovering, or they're just not getting their body enough time to recover at all. So you want to exercise for all the positive benefits in terms of bone strength, muscle mass, mental health, but don't overdo exercise thinking that it's going to help with weight loss. For some individuals, it raises cortisol. For some individuals, that's the stress hormone, of course. And exercise, doing too much, can also increase your appetite, which makes it much more challenging to stick with your nutrition plan. Exercise, when you do too much, can create more levels of inflammation as well. So be very cautious with the amount of exercise you do. Now, what is the best type of exercise? What is the best time? I believe the exercise that you enjoy and the exercise that you love to do at the time that you're most likely to do it is always the best. I would try to really avoid the long distance cardio. Typically, that does not do a benefit to many individuals who are struggling with resistant weight loss. You don't want to put significant stress on your body with too much exercise. 20 to 30 minutes, you don't have to give 210%. 70 to 80% of your effort is great, and listen to your body after. If you're really sore, you can't sit on the toilet, you've probably overdone it the next day, or you overdid it because you're so sore the next day. Popular medications for insulin resistance. So of course, this is not medical advice. You do need to speak to your practitioner, but I was hoping to give some education with respect to the top medications that are often used for insulin resistance. Metformin is a classic anti-diabetic drug. It's often the first line of treatment for patients. It does help to increase GLP-1, which can help with appetite suppressant. Now, metformin is not, the benefits of metformin do not just come from lowering your appetite. Metformin does help to reduce liver sugar production. It does help to reduce insulin resistance, and it can help to increase that key bacteria that we talked about called Akkermansia. For women with PCOS or polycystic ovarian syndrome, metformin reduces the insulin so that you produce less androgens or less testosterone, which can help with those hirsutism symptoms that you might experience. Now, what are some potential side effects of metformin? One, in some individuals, it can cause stomach pain, and in some individuals, it can cause diarrhea. For some, this is short, a week or two, and it resolves on its own. For others, it's just not tolerated. We also know that metformin, after about 6 months of use, can deplete vitamin B12 as well as folate. And these are really important nutrients for your nerves and for your brain health. So anybody who's on metformin should be getting their B12 and folate levels monitored, especially if they're on metformin for over 6 months, or consider supplementing if you're not able to get the testing done. Symptoms of low B12 and folate would be fatigue, anemia, tingling in your hands and feet, mood changes, headaches, nerve damage. So it is really important that you have these checked. Now, if you're looking for a B12 supplement, the one or the form that I would recommend is called a sublingual, meaning it absorbs under your tongue. A couple times a week, or speak to your doctor about the exact dosaging for you, can be great in terms of improving B12 and folate levels. A new classification of medications are called semaglutides. This includes the Ozempic, the Rybelsus, the Wegovy. Semaglutides also help by stimulating GLP-1. GLP-1 is the hormone that's really important for satiety. You can also stimulate GLP-1 with berberine, and you can also stimulate it with amino acids. So making sure you have enough protein or supplementing with amino acids may also be helpful. There is positive research in terms of lowering blood sugar and helping to lower hemoglobin A1C, can lower overall risk of cardiovascular disease, may support weight loss. Now, the problem with these types of medication, number one, is they're once a week or daily injectable medications. The Rybelsus is an oral form, but most patients in my experience are on the little tiny injection of the Ozempic or the Saxenda. This can cause nausea, vomiting, heartburn. Not in everybody, but if a patient says, I didn't feel well, these are the symptoms that I had, I wouldn't be surprised. Dosing low and slow and gradually increasing the dose may be helpful there. There is potential risks of thyroid tumors, including cancer, which is important to note. Now, this study was done in rodents. It wasn't seen in humans that we know of right now, and it was rare, and it's more common in individuals with a genetic predisposition to this. But regardless, it's important that you understand this risk. Long-term high dosages of these medications can also increase your risk of inflammation of your pancreas or pancreatitis. The goals of these medications should not be to put you on the max dose forever for the rest of your life. Short-term, they can be helpful while you also work on diet and lifestyle. But before you come off these medications, you want to know, when is the time that I come off? What is the goal for my insulin and blood sugar? What is the goal for my hemoglobin A1C? And what will I do without these medications to help sustain the results? And that's where some of the supplementation might come in. Popular supplements for insulin resistance include, or we're going to go into them. These are considerations. So what do you need to consider before taking a supplement? Number one, you might want to take a supplement to improve your labs. Some individuals do not want to use medications. Some medications are really expensive. So in combination with diet and lifestyle, these supplements may be helpful. For individuals who are not able to get the nutrients that we talked about in their diet, you could consider supplementing to bump those levels up. If you have blood work, you might want to look at what your nutrient levels are to really determine which supplement would be right for you. And sometimes supplements can have fewer side effects and symptoms compared to the medications. Supplements are not a replacement for a healthy diet, and they are not weight loss pills. Neither are the medications. You want to make sure that you discuss dosaging and you're monitored by a healthcare provider. I have had patients who take too much of a particular nutrient and they start to experience side effects and concerns because they are taking too much. You need to read the labels carefully. There is lack of regulation with supplementations. In addition, there is lack of not only regulations, but accountability for companies. Companies do not need to provide dosaging or proof of what's in their product beyond samples at the start of the company. They do not have to provide proof that what's in the product is in the product. They don't have to provide proof when they say, berberine is in a product, that they're using the correct therapeutic dose or the correct strain of the herb. It really is the Wild West when it comes to supplementation. So you want to choose a company that has quality testing, independent third-party testing. The supplements I'm going to show are my supplements from my line. Of course, I am biased to recommend these supplements, but there is tech sheets on my website if you want to see the particular ingredient. The particular ingredient comes from the same place. So if you can find another brand with that exact same ingredient, especially for the patented ones, it is going to be the exact same. Berberine. Berberine is one of my favorite herbs It has been shown to improve insulin sensitivity. It's been shown to be equally as effective to metformin. It can help lower androgens in women with PCOS and help to improve androgens in males. So we see different impacts depending on the patient, male or female. It's been shown to reduce inflammation, improves cholesterol, improves fatty liver disease, and may assist in weight loss. The important piece to look for is that you're getting an appropriate dosaging. The dose that's often included in research is anywhere from 1 to 2 grams daily in divided dosages, about 30 minutes before a meal or with a meal. Alpha-lipoic acid, this is one of my favorite antioxidants. It helps the body to synthesize glutathione, your master detoxifier, your master antioxidant. It also helps to improve energy while repairing insulin sensitivity. And this is really key because many patients with insulin resistance also feel really tired. So alpha-lipoic acid helps to recharge other antioxidants, makes your vitamin C, your vitamin E, and your CoQ10 more impactful, and may also assist with heavy metal detoxification. Therapeutic dosages of alpha-lipoic acid are anywhere from 500 to 1200 milligrams, about 30 minutes before your meal or with a meal. B vitamins. So remember back to that chart, many individuals who have insulin resistance and low energy are deficient in nutrients, and B vitamins are one of them. So if we look at the left-hand side, this is a picture of the citric acid cycle. So this is essentially the process that has to go on once the sugar gets inside of your cells. So this process here, if you look at the carbohydrate piece, it requires ALA is right there, which we previously talked about. The B vitamins are really important. Magnesium is another really important cofactor for this cycle. It's important not only to get the sugar into the cells, but we also want to ensure that we're generating ATP so that individuals can feel their best. B vitamins support carbohydrate metabolism, support the adrenal glands, so you're going to need extra B vitamins if you're under stress. Birth control, hormone-based birth control has been known to deplete B vitamins, so it might be worthwhile considering that. Metformin's been shown to deplete the B12 and folate. So supplementing with B vitamins is often beneficial for individuals' hormones, mood, nervous system. Magnesium we talked about, it's a very important cofactor for that Krebs cycle. It's the most common mineral deficiency. It's important for blood sugar management, blood pressure management, mood, muscle tension, insomnia, migraines, energy production. I like to use a combination of magnesium malate to help with the increased production of ATP from that Krebs cycle, as well as magnesium bisglycinate. Majority of the companies that use magnesium bisglycinate, magnesium malate come from the same source. It comes from Albion Minerals. As long as the magnesium shows 150 milligrams of magnesium bisglycinate, that is going to be perfect. If it shows 200 milligrams, that is creative labeling. The max dose of magnesium bisglycinate that you can fit inside a capsule is 150 milligrams. So they've obviously added some magnesium oxide or other forms of magnesium that are not as well absorbed to make that label look more desirable to an individual. I would stick with the companies that do 150 milligrams that are being transparent with what's in their supplement. A dose of 300 to 600 milligrams is key. Other ones, so this, it seems unrelated. It seems unrelated to take a probiotic and fiber to improve your blood sugar, but we talked about the research as to why that would be beneficial. Tummy tone paired with the fiberline has been shown to reduce body fat mass in about 5 months by 4.5%, which I think is really awesome. This is my favorite drink. It contains myo-inositol. I drink this all of the time, not only to keep my blood sugar stable, but it also has things in it like GABA, L-theanine. It has taurine in it, magnesium to help calm the nervous system. So before every presentation or before a stressful day with patients, I drink this. It tastes really good. So I'm, of course, biased, but I love the taste of it. Myo-inositol can improve your blood sugar, enhance sleep, calm mood state, can help with cholesterol, blood pressure, can help women with perimenopause and postmenopause, helps to reduce cravings, and can even regulate your periods. Men as well can take myo-inositol, but in women we see the improved egg quality and the menstrual regularities. Here's a study that looked at the impacts of alpha-lipoic acid with myo-inositol, and they compared that to the effects of metformin. Metformin resulted in a 15% reduction in BMI, reduction in the HOMA-IR, so this is a marker for insulin sensitivity, by 13%. And when metformin was combined with myo-inositol and alpha-lipoic acid, we saw a 28% reduction in BMI, and a 33% reduction in insulin resistance, which is pretty great. So can you use supplements in combination with medications? Yes, but you always want to speak to your doctor and make sure that you're not doing too much and you're causing low blood sugar. Now, for women who are in perimenopause or menopause, there's studies looking at myo-inositol as well as myo-inositol combined with alpha-lipoic acid. We look at HOMO-IR. We see huge reductions in insulin resistance with this combination. Fasting insulin goes down, glucose goes down, triglycerides go down, HDL goes up. That's your good protective cholesterol. Your total cholesterol goes down, and your diastolic and systolic blood pressure goes down, which is pretty profound. So we're seeing really big changes in postmenopausal and perimenopausal women as well. For women in pregnancy, taking myo-inositol has been shown to be safe in pregnancies and can help with the prevention and treatment of gestational diabetes, helping with your glucose, helping with your triglycerides, helping with your systolic blood pressure. Vitamin D. So we talked about how vitamin D is important for insulin resistance. Vitamin D is also important to have healthy testosterone levels in males. Vitamin D is important as an anti-inflammatory. It's important for egg quality in women. Now, the important piece with vitamin D is you need to test, not guess. Do not take vitamin D if you're not deficient in vitamin D. You can overdo it. So testing your levels can really help to dictate what the best dose would be for you. Keep it simple, make it easy. So I know how overwhelming it can be with a variety of different supplementation. The best case scenario would be to run your lab, see what's going on, and develop a custom plan for you. I do offer one-on-one visits. I understand that the labs can get cost prohibitive and the visit can get cost prohibitive. So it's something to really help individuals who are struggling with insulin resistance. I've put together my favorite supplements in an easy to take med pack. So these packs you would take your AM pack 30 minutes before your meal, your PM pack 30 minutes before your next meal, and your bedtime pack before bed. So this contains the B vitamins, it contains berberine, chromium, which we didn't talk about, the Situ, which we'll talk about next, ALA, the fibrillin, all in therapeutic dosaging. So for anybody who has prediabetes, insulin resistance, this can be helpful. Typically, patients will be on these packs for 3 months, will repeat their insulin, see where it is, and then reevaluate which key supplements are important for them to continue as part of their maintenance. Before bed, you have the tummy tone, so that's the probiotic designed for weight management, and the magnesium. It's important if you are taking berberine not to take it at the same time as the probiotic because berberine does have some antimicrobial properties. Now, what is not included in this pack? What is not included is the vitamin D because not everybody needs vitamin D, not everybody is deficient in it. A lot of individuals are, but it's really important to measure your levels so you know exactly what you specifically need. I have also not included the cortisol reducer. So cortisol reducer is fantastic for a lot of individuals who have low testosterone, who have issues with their cortisol. And the problem with it is ashwagandha can be really great for people who have hyperthyroidism or for people who have higher levels of testosterone. Ashwagandha may not be beneficial. So if you have low thyroid hormone, ashwagandha, yes, is great, but if you have high, it can make you feel anxious. And then, of course, I didn't put the Relax and Focus and the Aminoline in this because those are powdered. So those would be things that you could take as needed on the side. Situ is a very new ingredient that I have introduced into my supplements. I first looked at the research on Situ, and one of the things that really caught my eye is the impacts that one dose makes. So the research has shown that one dose of Situ has been able to reduce glycemic stress by up to 48.3% on the first use. So what you would do is you would take the Situ about 30 minutes before. That's why you take the AM pack 30 minutes before your meals and the PM pack 30 minutes before your meals. Clinical studies with Situ have shown a positive impact on reducing post-meal blood sugar, improving insulin sensitivity, and maintaining optimal blood sugar. So this is one that I was really surprised and really pleased with the research on, which is why I've included it now with the berberine. So the berberine contains berberine, the chromium, and Situ in these supplement packs. Here is the overall dosaging of every single ingredient that you would get, the daily dosage in that pack for anybody's interested. You can review this in additional detail, but you get your therapeutic dosages of your ALA, your berberine, your in situ, your B vitamins, your magnesium, your chromium, your bifidobacterium subspecies Animalis lactis B420, and your popomannan fiber, which has positive impacts on the gut microbiome, as well as appetite control and cholesterol management. Okay, so I think that's all I have for tonight. Yes, so there is 1, 2, 3, 4, 5, about 5 pages of different references there, all related to what was chatted about in the research or in this presentation. If you have specific questions, I'm happy to answer them now. If you want to get in contact with me, I'll be sending out a recording about 24 hours after. It'll have the recording, it'll have the links to the Rupa Health for your blood work. You will have the links to the glucose sheet, everything that we chatted about. I'll summarize it nicely in an email for you. Okay, so sorry, yes, there was a question here about HS and acne alone. Can this be indicative of insulin resistance? Yes, insulin resistance is often an underlying factor for HS and acne. This is because the insulin resistance can raise that free testosterone, and then we start to see more oily skin, which the bacteria can ferment and cause some of those boils, the follicles being clogged, as well as the acne. So this is why using things like the berberine or even fish oils can be helpful here. You don't need to have a high BMI to have insulin resistance. That is a misconception. So individuals who are at a healthy body weight, you can still have insulin resistance. Individuals who are at a healthy body weight, unfortunately, they often don't get tested for this and they don't get diagnosed, especially patients with PCOS. So it is important to measure to see if that is impacting you. How long can you take berberine? So there is some small concerns, they're more hypothetical concerns with, does long-term supplementation of berberine lower your healthy normal gut bacteria? We don't have strong research to suggest that that is the case. I have patients that stay on berberine for 6 months to a year. Sometimes we have them come off for a couple months, then put them back on. Yes, there is the hypothetical potential that it might lower certain healthy gut bacteria, but we're often using the tummy tone in combination. If you're concerned, you could always cycle on and off. So you could use the berberine for a couple months, then use ALA or Myo-inositol for the other months. But, you know, even now that, you know, I have optimal insulin levels now, I didn't always. I have my autoimmune thyroid condition in remission, which is awesome. Now I will use berberine as needed. So if I'm having a higher carbohydrate meal because life happens, or I'm going out to a restaurant, or I just want to mitigate some of the impacts, then yes, I'll take one of the AM packs or the PM packs because it has the berberine and the in situ in it. So it'll help to mitigate the impacts and reduce the absorption of the carbohydrates at that meal. Sorry here. Where do you get the med packs? So the med packs are available on my website, on my supplement store. Keep in mind, these are made to order. So in terms of being aware of some of the concerns in the supplement industry, I do not like supplements sitting for long periods of time at a warehouse, and I do not like supplements sitting there where the pressure is on to sell them. So I actually don't store the med packs. They are made to order, so they are really long shelf life. I have guaranteed that, you know, there's not any concerns with them being in the heat or any concerns like that. So it will take, you know, a couple extra days to get to you. The warehouse is in Florida. So depending on where you are, that might dictate where they are coming from. So essentially they're made, they're shipped to my warehouse, and they're shipped out to you right away. Are first morning fasted workouts helpful for insulin resistance? Yeah, they can definitely be. So if you have higher levels of sugar in the morning and you feel good exercising fasted, great. If morning does not work for you, if it's not a good time, if it's creating more stress, then don't work out in the morning. Work out at a different time. Taking apple cider vinegar or vinegar before a meal, anything bitter like that, has been shown to lower the blood sugar spikes, which is fantastic. So if you like that, I would always dilute it in water so you don't damage your teeth, but you can totally do apple cider vinegar before a meal. That is not something that I particularly enjoy, but if you do, go for it. How long does it take for insulin resistance to develop? It really does depend on the individual. Some individuals can have insulin resistance for years and just not know it, and there is that big genetic component to it as well. if you order from Rupa Health, how can we have you interpret the results? So yes, you are welcome to order the labs through Rupa Health, and then we can set up a one-on-one consult for me to review them with you. And we chat over a secure virtual platform, and I'll go through the line item by line item for you. So I'm very passionate about ensuring that you understand what each marker means and what would be the optimal ranges versus just the normal ranges. So we can definitely discuss that and walk you through it so that you can easily understand. Would black coffee on an empty stomach not raise cortisol and potentially contribute to early bowel release? Depends how sensitive you are to caffeine. Yes. Black coffee can definitely be irritating on the stomach, irritating on the intestines. Typically, I don't interfere with individuals' coffee because I wouldn't be necessarily wanting to give up coffee myself. So if it doesn't make you feel good and you want to remove it, perfect. Sorry, going down here. Okay, perfect. Can you take iron if you have thalassemia? That's really patient specific and not something that I specialize in or know a lot about in my practice. So I would speak to your family doctor or your hematologist to really get a good idea of where your iron is, where is your ferritin, and what would be the best next step for you. Is it true that you can determine insulin resistance by dividing the triglycerides by HDL? Yes, you can absolutely get predictive markers, and it's pretty good in terms of what the literature has to say by looking at doing that calculation. There are online calculators that you can do. That is a great strategy for individuals because most times the cholesterol panel is run. So yep, you can definitely get an idea, and you want to make sure that it's within the optimal range. In order to get on a one-on-one patient appointment with me, you would just contact my patient care coordinator. She's fantastic. Her name is Allison at my office. If you look at my Instagram or my TikTok, there's going to be a link to be able to find her contact, or you can call or text or email. It's on my website. You can submit through the website too. I did have issues with my website a couple of days ago, but is back up and running now. What is the timeline for how long how long it takes to fix insulin resistance? I have seen insulin resistance resolve in 3-month time periods for individuals who are doing dramatic changes in their diet and lifestyle and taking either medications or key supplementation, prioritizing lifestyle, stress managed sleep. For others, it can take a year. It really just depends on what lifestyle changes you're willing to take and how your body uniquely responds. Everybody is going to be different, and it's not necessarily a sprint. But in the Reset program, we focus heavily on insulin resistance, and individuals lose 20 to 30 pounds in 6 weeks when we do that. So there's definitely a possibility to get this fixed or at least get a big headway on it in 3 months' time. If the waist measurement is showing insulin resistance, is that what is most likely, or is testing still recommended? I really like testing. I like to see the before. I like to implement a plan based off of the labs and the symptoms and do a follow-up blood panel 3 months later on the ones that weren't in the optimal range. I find that helps explain to patients what's going on. It gives them an objective marker. It gives them something to look forward to repeating. And I really, really like to do that. Now, I understand that there's cost prohibitive factors when it comes to testing. If everything was free, I would say, of course, test before and test after. We know that only 12.2% of the population is metabolically healthy. So if you have the symptoms and the waist circumference is higher, then I would implement a strategy for insulin resistance. And if you're looking to reduce the costs of the labs, maybe you implement a strategy for 3 months, see how you do, and then measure the insulin after that to say, okay, now can I add carbohydrates back in? Can I reduce some of these supplementation? Where am I at this point in time? And that can help to determine a maintenance plan. So if your insulin has come down, but it's still not optimal, then we might say, okay, let's stay on the Berberine. Let's stay on the Myo-inositol and keep carbs moderate until it gets into optimal range. Once it's optimal, we really want to encourage you to increase carbohydrates. I definitely can provide a blood requisition in Ontario. Yes, and we can get some of those labs run under OHIP as well. Sorry. Find it difficult to lose weight. Sorry, I'm missing the first part of that question. Does improving insulin help hormones regarding fertility? Absolutely. So if we think back to one of the first slides where it showed that elevated levels of insulin can raise your free testosterone and stop you from ovulating. So if you're not ovulating due to the insulin resistance, fixing the insulin resistance can help you ovulate and improve outcomes. There are studies looking at berberine and myo-inositol in patients who are undergoing IVF with superior outcomes, which is really great. Myo-inositol is safe to use in pregnancy. Berberine, we do not have safety studies to show that it is safe in pregnancy. Now, the studies used berberine leading up to IVF just fine. Berberine has a very short half-life, so as soon as you find out you're pregnant or when you suspect post-ovulation that you could be pregnant, I would take the berberine out because we just don't know the safety status there. Eliminating carbs can be difficult for a lot of people. What suggestions do you have about curbing the amount of carbohydrates a person eats? Yes, I absolutely agree. Taking carbs out completely is not something that I recommend. I don't recommend a ketogenic diet. I have individuals on the Reset program. Yeah, we're reducing a lot of the grains, but we're still consuming fruits and tons of vegetables. You do not want to eliminate carbohydrates for long periods of time. I only have patients lose weight for a 6-week time period. After that, the thyroid function starts to go down. So the Reset program is divided into losing phase and maintenance phase. Losing is just 6 weeks, so we're being very intentional for 6 weeks, and we're adding the carbohydrates back in. Now, using the berberine, the AOA, the Situ, essentially these MRP reset packs can be particularly helpful for those times where it's hard to reduce carbohydrates. I would prefer to do something that would be sustainable long-term and not create any negative associations with foods. Many individuals do not have a food problem, they have a hormone response problem to the foods that they eat. So if we can fix that with some key supplementation for a 3-month period, then you won't have to be as restrictive with your calories and as restrictive with your carbohydrates. Once your insulin resistance is under control, you should be able to tolerate carbohydrates in the amount about 2/3 the size of the protein. So if you have your food scale, and remember you're going to measure about that 5 ounces of protein, visualize it having 2/3 the size be a healthy carb like rice, quinoa, pasta, lentils, beans, things like that. Everybody is going to respond differently. So in the Reset program, that's why you work with somebody weekly, one of my amazing coaches, and we monitor your food. So we monitor your food, we monitor your weight, your water intake to gain insight. It's not to be restrictive, it's to ensure that you're eating enough food, you're eating the proper macronutrients, and if you have a food that's raising your blood sugar and creating a lot of inflammation, then we can look at your journal and say, okay, for whatever reason, it seems like mangoes are a problem for you. Instead of mangoes, let's try blueberries. Or whatever reason, it seems like sweet potatoes are a problem for you. Let's try white potatoes and see if that makes things better. Each individual is going to respond differently because we're all unique. And developing a plan that not only helps you lose weight, but sustain it long-term is key. So I hope that was helpful for you guys. That was longer than I intended it to be, so thank you for sticking around. If you have any additional questions, feel free to contact my patient care coordinator, Allison, at my office. I'm always looking for suggestions on content, different videos to create on Instagram and TikTok, so if you wanted to follow along there, I would greatly appreciate it. Thank you so much for joining. I hope that was helpful for you, and we'll talk soon.